So there are lots of different kinds of fillers. It's not just one sort. And sometimes patients will say to me, oh, well, if I'm having that, if there's any left, can I have it in this area? Often I have to say no. And it's not because I don't want to give them what they want, but it's more because you have to be very careful about the different thicknesses of fillers. And if you put the wrong thickness in the wrong place, it may either just not do what you want it to do, or worse still, it may actually make it look worse. Let me give you an example. We have really thick filler. So I often will think of my fillers as a paint box. So I have a paint box, I have like my emulsion paints, my really thick paints that will stay around. So they are my really thick fillers. So they're the kind of fillers I'll use in jawline, I might use it in the cheeks, I may use it in the nose. So it's almost to create that illusion of bones, so to speak. Then on the other end of the spectrum, I have what I call my watercolour filler. So my watercolour fillers are very, very watery, and we inject them much more superficially, and they don't create that scaffolding. If I were to put a really firm filler, for example, in very fine lines around the mouth, it would create too much volume, and it would also create bumps that would find difficult to dissolve. So we'd actually see those bumps quite visibly, and that's obviously not what you want. So sometimes I may have to use 3 or 4 different fillers across a face to address different issues, because ultimately I want you to look like you haven't got filler. So that very much depends on which filler I choose.